Peter Moilanen is my name, and I have the pleasure to moderate this session, and I work as the head of Drug Policy Center. And today we will listen to Sara Heine, who is experienced in international drug-related work, you could say, and she also works as a communication officer for Drug Policy Center. But in this case, you have written a report that gives voices, I think, to those heroes in the local way working with prevention and how to solve this matter. So the floor is yours.
Thank you. And the mic is on, I can hear. You can hear me? Yes. Okay, great. So coming after Berta Madras is not an easy task. But then again, linked to what Berta said, she really shows the importance of working with prevention and early detection. So I think it's just highlighting what we have been talking about both before lunch and now. So thank you, Peter, for the presentations. My name is Sara Heine, and I work part-time together with Peter at Narkotikapolitiskt Center, the Swedish Drug Policy Center, you can say. It's network or a think tank that consists of 16 organizations which all have a broad experience when it comes to working with prevention, early detection, treatment, and peer-to-peer support and recovery. So I'm not a researcher, but as Peter said, we are trying at Narkotikapolitiskt Center to follow research, to follow the narcotic debate, but also really to listen to all of those who are affected by drugs in different ways, both of them who have had an use or abuse of drugs, their families and relatives, but also all of them who are working with drug-related issues on a daily basis. And I would say that the stories of those peoples are very seldom heard in media. Because in media, which is quite polarized in Sweden right now when it comes to narcotic issues, you hear about quick fix solutions. It's either legalization of cannabis or having a tougher punishment. And those are not really, they hardly solve the reasons why problems actually arise. But outside the media debate, the reality is quite different. The picture is quite different. And here are many examples around the country in Sweden of how development can actually be reversed to a positive one, and how a good structure for prevention and for early detection can contribute to reduced drug problems. But there are also a lot of examples of how we need to change or strengthen several areas of our preventive work or the early detection to be able to reach those results. Now, I have a quote here, and I've been using this quote several times, so maybe some of you have seen it before. But it's a wise one. The quote is from a girl or a woman today called Ella, and I made an interview with her about 1.5 years ago. Now, Ella, she started to drink when she was 12 years old. Her parents went through a quite tough divorce, and her father started to drink, and there were always alcohol around his house. So when Ella spent every second week in his home, his house, she also found alcohol. And she was not drinking with friends, she was drinking alone in her room because it made her feel a little bit better. Ella had problems in school, but no one really saw her problems or her as a person. So she went through school, and as a teenager, she started to use amphetamine. And she was taken twice by the police, and she was taken to the social service office, but nothing happened, because she was able to tell them that this was the first time she has used amphetamine, and she would never do it again. And they believed her. Then things went quite fast, and Ella started to use all kinds of abuse of drugs, and she got addicted and homeless. And it wasn't until she was in her end of her 20s that she was actually taken to a treatment center. And then she had to go for treatment for a whole year. And she was lucky because she got not only treatment, even though it came far too late, but she also got contact with a civil society organization. It happened to be a church. And they helped her through her recovery process. And we can learn a lot from Ella's story. And unfortunately, Ella's story is not unique. There are a lot of Ellas around the country and probably around in the world. And her quote is wise. It says that looking back, I wish that someone had checked on me. It felt like no one ever saw me, and that's why I developed such a hatred towards all adults. And her story shows several things. It shows that it's not enough with treatment, but you need support in your recovery as well. But it also shows that the gaps that are between the actors that are around a young person, because there are a lot of actors, a lot of authorities around a child that could be able to prevent and to detect a problem. It could be substance use, it could be other problems as well. But in Ella's case and in other cases, that is not working well. And the result is a high cost. It's a high cost for society. It's a high cost for society when it comes to economic angles. But it's also, of course, a high cost for the individual, for Ella's family and for those around her. So, no? Okay, great. So after I had interviewed Ella, I decided that I wanted to try to find out where and why are there these gaps in the system that we hear about quite often. And what is needed to close those gaps, and what results can be achieved if we are able to close them. So I interviewed quite a large number of people from all over Sweden, people who work with drug issues in various ways. There were researchers, local coordinators for ANDT, that's alcohol, narcotic drugs, doping and tobacco, police, school counselors, etc. And many of them are in one way or another a part of the report that I wrote over a year ago. And I would like to share some of their views and some of their experiences and examples. And the interesting thing was that even though I did interviews with people from all over the country and also had different kind of occupations, the role into this issue were different from each other, but their stories were very much the same. They had the same picture of the problems, the challenges, and the need. However, when it came to how far they had come in working with prevention and early detection, some of them had come a very far way. They had a good structure and they could show good results, while others didn't even know what to do or plan their work for tomorrow. That's exactly what they told me. So that's a situation we can't afford to have. We need to share between each other and between different municipalities who have come, especially those municipalities who have come a far way. And I will show some examples from them as well. Now, the challenges, they were quite common. So within the interviews, they had about the same view of the challenges. There's a lack of a common picture of the situation, of common goals and action plans. The role and responsibilities of each actor and authorities when it comes to the school, municipalities, social office, or the police were unclear, and a lack of structures and routines for collaboration. And this last part is very important. Sometimes there was a lack of a person who actually is responsible to lead the work, what we would call the Swedish samordnare. someone who is a coordinator for ANDT. And the coordinator is, of course, important, because if you start a network and you don't have a responsible person to lead the network, nothing will happen. So having a coordinator is really important. And here are some quotes from the report. The first one is from a coordinator who is trying to give a picture of what is needed for a person who coordinates this kind of work in a municipality. They have a key function. It's a person who it's a person who must be able to switch between a strategic, operational, and practical level, and at the same time be able to engage and mobilize local actors and drive the work forward. The other quote is from a police, and they say that if there is no one responsible for ANDT in the municipality, it's necessary that there is someone else who just, feels a commitment, even though they aren't formally responsible. But that is a vulnerable and very short-sighted solution. So we know it's important to have this key person in place. Now this shows, this is from the annual report of the Swedish drug situation, which is written by the Public Health Agency, Folkhälsomyndigheten. And the purple line, that shows how many coordinators for ANDT that we have in Sweden. It's about 210. We have 290 municipalities in Sweden. So not all of them have any coordinator at all. But the green line, and that's the worrying line, it shows that the time they have in the role that they can actually devote to working with these issues is about half of what it was 10 years ago. And that means that the persons who are coordinators today have to work with a lot of other assignments outside ANDTS. I've even met a coordinator that had 5% of her role located to work with alcohol, narcotic drugs, tobacco and doping in the whole municipality. She said that that was enough for one meeting per week, approximately. That doesn't do any difference. So, why do we have that kind of situation when it comes to prevention? Well, this is another quote from a coordinator saying that maybe the problem is that investing in prevention is that it's only the expenses that are visible. This is what we heard about before lunch as well. It's never the money we can help save through our efforts, because how do we actually measure a problem that doesn't occur? And I will actually come back to that question later on, but I think also quoting Dr. Marloff from UNODC that we heard this before lunch, he also said that not investing in prevention comes with a cost. So I think we should remember that. Now, as I said before, there are many persons or authorities around a child that can actually work, that are possible to act for an early detection. But if the detection should lead to intervention, to results, they need to cooperate. And when I did my interviews, it was clear that many of the problems that occurred on a local level was actually due to the lack of cooperation and the gaps between these different actors. Ella, for example, she was detected by the police twice. That worked. But when she came to the social service office, thank you, it didn't lead to any intervention, so it didn't really give any results, because there were no cooperation in her municipality between the school, the family, the social office, and the police. And here, of course, parents and family are very important when it comes to early detection and to prevention. And I don't have a slide of this, but within the Nordic countries, there are actually several studies that shows that when you ask young people why they stay away, why they don't use narcotic drugs or alcohol or tobacco, there are about the same causes in these different studies. And it says it's the relations to parents. If they have a good relation to their parents, that's a very good preventative factor. It's school. It's having leisure activities, like being a part of a sport association or a culture club. And when it comes to narcotic drugs, it's also about the prohibition, that it's actually forbidden to use narcotic drugs. That's also a preventative factor. Now, coming back to this slide, families, and there's a lot to say about this. We heard this also before lunch. The relations, the parenting strategies, if they are good ones, are protective factors, but there are also risk factors within the family, of course. For example, conflicts at home or abuse, alcohol or drug abuse, or physical or mental health. But there are also, of course, ways to strengthen the protective factors through general or on a group level prevention measures, like having parents' meetings or family support, or to be able to reduce the risk factors by working with families who have drug abuse in the home in one way or another. It's also important here to work with parents from a very early age. We heard about that before lunch as well. Both, from pregnancy, home visits when you have a newborn, preschool, etc., to detect risk factors, but also to build a trust and understanding between the authority and the family, because that's really an investment if there are any contacts or interventions in the future. School. One of the most important part or actor when it comes to early detections. The teacher meets the students every day on a daily basis and is one of the most important adults in a child's life. And together with the police, the two actors in Sweden who stands for most of the reports of concern to the social service is the school and the police. So they are important for early detection. Now, there are ways, of course, to strengthen the protective factors in school by having sufficient resources to ensure that students complete their schooling. I went too fast there, didn't I? Yeah. Protective factors in the school is, of course, finishing school. That's one of the most important protective factors for many things, not only substance use. And of course, a risk factor is not succeeding in school or not passing school or being a school dropout. Strengthening these parts could be done, of course, with sufficient resources, both when it comes to teachers, to student health, counselors, and actually to creating an environment in the school that is welcoming, including, and a safe place for children and youth. So it's important for schools to actually have a plan on an action plan on how to work with this, a policy. And this is not rocket science, even though I understand that it's challenging. But we have schools in Sweden today who have come a very far way. And we have schools in Sweden who have no action plan or policy at all. So we are actually the children themselves don't get the same treatment, sometimes not even within the same municipality. So this is one way to work strategic for early detection that some of the schools that I interviewed also told me about. As I said before, the teacher meets the student on a daily basis, and through their experience and their knowledge of each student, of course, they also feel when something is wrong. They are the ones who can see the small changes in behavior from one day to another. They can see if the child is sad, relation to friends, negative changes in school results, school absence, that the student often has stomach ache or headache, something is wrong. And these are actually indicators. And those are indicators that are needed to be followed up. So they can be indicators, of course, of different problems, not only substance abuse. It can be problems at home, relations to friends, stress, criminality. But nevertheless, it's about early detection of a situation that needs an intervention in one way or another. And coming to narcotic drugs, of course, that can be a cause to the problem, and it can be the problem itself. So they are interacting with each other. And you need to follow up these indicators. They are important. And that can, of course, be done when they have these conferences with other teachers and student health, where they can talk about the development in specific classes, groups, or students that they are worried about. And looking at indicators and follow-up indicators has to be a systematic work. And one way to do this is to have a list of concern, to actually list the persons, the individuals, the students that they are worried about, that they have seen signs from a teacher, from student health, and together do a list and do a follow-up, making sure that students are not ignored. Coming back to Ella again, that was what happened during her time in school, all her years in school. And it's important that the school has routines in place for the next step. It's important to have policies and action plans, because it will happen things. You don't have a school where nothing ever happens. And you have to know when to contact the student health, how and when to have contact with the parents, when to do a report of concern to the social service. And it's important for everyone in school and everyone involved to know these routines. And one way to start is to get a common picture at the school of the situation within the school when it comes to substance use and the situation in the local area. And it might be that the municipality is actually doing studies of youth in the municipality and of substance use, then attitudes, habits, etc. So the local coordinator for ANDT, if any, in the municipality, can of course, together with the local police and field worker, help out to analyze the situation together with the school. Here are two other quotes when it comes to schools that I also have in the report. And the first one is a quote from a field worker working in the south of Sweden and working in a municipality where there is no collaboration between the different actors. And it shows the gaps very clearly, I would say. When we talk, that's the field worker, to the student health, they expect us to be the ones to act when a situation arises. It feels unclear. We don't know if we are the ones who should make a report of concern or if they should. We simply don't know what to do when we suspect something, which means that nothing happens. The other quote is from a school in a municipality where they have a good collaboration, where they have a policy and action plan that everyone is aware of. And they also work with something called samtyckesblankett in Swedish, or concept form. And a concept form is an agreement to be able to lift the confidentiality and making it possible for the school, the police, the social service, and the family to share some information about the student to be able to follow their development. And they say that if it turns out that the student is using drugs, we can start our collaboration immediately and discuss what efforts are required. And if the police then in the evening meet the student in town, they know that he or she is already receiving support and help. And the school can in turn receive information that the student is participating in counseling and taking tests. So everyone can sort of work together as a network around the student. So, this is what we would like it to look like, the tight collaboration between the different actors where there are no gaps in between them. And we actually have several examples around the country where they are working in this way. Now I would just like to say that having this collaboration, that's not the preventive measure itself. That's what comes afterwards. But having the collaboration makes it possible to actually do a good prevention work and good early detection. So those municipalities who have come a far way, they say that their way to succeed has been to have a common picture of the situation together, to have common goals between all the different actors, civil society, schools, social service, Mini Maria, police, etc. To have very clear mandates and responsibility and sufficient resources, and to actually have the local politicians and decision makers with them. The understanding from politicians that prevention and early detection of substance use is not a question for one person who can work 5% of their time with these issues. It's not a question for one unit at the municipality, but it's an intersectional one. And of course, having a coordinator that can ensure that you can work with cooperation. Now I would like to share with you two examples, two municipalities who have been working with different kinds of models for collaborations. And I will just briefly tell you these examples, so I think you should then Google them, because there are research done on both these models, so there are a lot of information to be gained if you have a look at their websites. This one is from Norrtälje. Norrtälje is a municipality situated about an hour north of Stockholm. And they started with having one person who was having part-time work with ANDT, and today they have an office with 12 persons working not only with substance use, I would say, but also they work with something called TINK, Trygg i Norrtälje kommun, safe in Norrtälje municipality, directly translated. And they work both with crimes, but also substance use and abuse among young people. So they have an office that is placed in the municipality on the management level. And then this is their model for cooperation, and it's quite interesting actually, because they have local groups as one platform. And in the local groups you have representatives for school, social service, police, and civil society, for example. And they meet together regularly. They know each other. They are a small group. And they are the ones who work on a grassroots level, so they are the ones who are really can make a situational analysis. What does it look like right now? What have we seen around in the municipality? What are the problems, the challenges? What do we need to do? And then the questions they raise, they go further on to the next platform, which is the TINK Council. And in the TINK Council, you have the bosses, the superiors of those sitting in the local groups. So they are the one who can take directly decisions on the questions that raised in the local groups. So it's a quick response back. Those issues and questions that needs to go further on goes to the municipal management that also have regular meetings concerning these, and then further on to the decision makers, the politicians. And they of course can make sure that there are resources enough or taking policy decisions needed to be able to do a good job on the local level. So that's the structure. I would also like to mention that they are working in a very interesting way with the schools, because they are actually having group meetings with all the principals of the schools in the municipality. And they don't do any difference whether the school is a municipal school or a private school, because they say that within our municipality we have a responsibility for all young people, no matter what school they go to. So they have meetings for principals. They together find out good ways of having an alcohol and drug policy, having an action plan. And they also have a safe room for these principals to be able to dare to ask questions, because it's challenging to be a principal and to be responsible for having a drug-free school and safe environment in school. So they have an interesting model for that. So by having this platform for collaboration, which they have had for, I think, 12 years now, they have tried out different methods. So they dare to try new methods, and then they evaluate it together, and they might adjust it if needed. And I will show you some of their results. And the results are quite clear. This is a result when it comes to crime prevention that has to do with having an alcohol and drug-free school graduation. So they did a method called walkabout. And from what you can see then, that from one year to another, they started this in 2009, they were able to reduce the number of crimes dramatically. Before that, I've seen the years before, they were between 70 and 80 crimes per year during school graduation. And there have been none since 2011. Another indicator is narcotic drugs. You see that the orange and yellow lines are for the consumption among youth on Stockholm region, and Norrtälje belongs to the Stockholm region. And the blue lines are for Norrtälje. And as you can see that from 2015 and onwards, the consumption has reduced. Same thing goes for smoking. The blue lines are for Norrtälje, the yellow and orange ones are for the whole Stockholm. So, is it possible to actually, you remember the quote from before, measure a problem that doesn't occur? Well, in Norrtälje they've had researchers following their prevention work. Among them is Håkan Leifman, who is here today, but at the other seminar, you will be able to listen to him tomorrow. But they have also had researchers from Uppsala University who has been trying to calculate how much money that is saved due to the prevention and interventions. And I think this makes Norrtälje a very interesting example, because this can be used in other municipalities in Sweden or in other places in Europe, I would say, as an example of how you can actually put in quite a lot of money into prevention, but in the end actually gain money. So this walkabout, for example, on school graduation, alcohol-free school graduate, has reduced the number of crimes, as you saw. So that means a reduction in cost for society, with about 2 million Swedish crowns per year for Norrtälje. Smoking has reduced the cost, that's a long term, so that's counted on 5 to 10 years, with about 26 million crowns. And that's money that is saved for the municipality in Norrtälje, but also for the region Stockholm, and on a national level, so on all three levels. And then narcotic drugs, about 5.7 Swedish million crowns per year is saved by having the reduced consumption of narcotic drugs in Norrtälje. So, my last example is from another municipality in Sweden called Trollhättan. And Trollhättan is situated about an hour north of Gothenburg instead. And Trollhättan, they have had a program called TUTI, Tidig upptäckt, tidiga insatser, early detection, early interventions, that they have been working with for, I think it's 3 years. And they have also had researchers, and that makes it interesting, even more interesting. And they have just come out with their report from Högskolan Väst about a month ago, and a report describing this project and the result. Now, this early detection program is not only about substance use, it's about early detection of minor crimes from an early age, focusing on children between 11 and 17 years old. But many of these minor crimes are actually minor drug offenses and drug use and abuse. The reason that they started this project was that before, it could take several months before support was put in place for young people who had committed crimes. And sometimes there were repeated reports of concern to the social service office, but nothing happened. And there were also lack of direct support for the young person and their parents in connection to the actual crime. So the aim was, one, to develop prevention methods for young people at risk and for their parents as well. But also, two, to develop working methods for early detection and cooperation between the important actors, the police, the social service, civil society organizations. Now, there are lots of different parts within this project. So I really think that if you can read Swedish, you should go in and read this report. But I've highlighted a few of them that are more linked to narcotic drugs. One is that they have a family therapist, behandlare i beredskap, which is called in by the police when they have a young person, a child, who needs to be taken home due to suspicion of drug addiction or minor drug offenses. That means that even though it's 11 o'clock in the evening, this therapist will be following the police to their home, talking to the parents. And the child and the family are directly offered a support called Stöd att låta bli, which is inspired by different programs when it comes to motivational programs, for example. And they can see that about half of the youth that are given the possibility to do these programs are also taking the whole program. And what is interesting is that What is interesting is that when the researchers looked at this, they saw that the earlier in use that they were actually detected, the more motivated they were to actually go through the program, which shows that the early detection is so important. And when they asked the children or the youth afterwards, when do you think is the right time for someone to intervene? They all said, the first time I committed a crime. That's the time to intervene. So that's interesting. The second thing they do is that if they go through the program, they try to do like a survey around the child. They look at their risk factors, their protection factors that are linked to their home, to school, and to leisure time. And the youth will also be helped to reflect on what actually happened on the time they committed the crime. But they will also be helped of trying to visualize their future and what they see in front of them. And their action plan is actually based on their future dreams. So it's a very positive one. So that could be help more support in school to be able to go through school. Or they even have 2 counselors that are a link between the municipality and the civil society that helps the children and youth to get good leisure activities if there are none. So that they get into a sport association or a culture club, they can even get their fees paid. So making sure that that is the family, the school, and the leisure time are important platforms for the child. Now, in addition to what I already mentioned, the research shows that the young people who participated in this tuti generally thought that the interventions were very good. But in order for the interventions to not have a stigmatized effect, it's important that the entire chain is being done, because that is needed to create an understanding and acceptance among everyone that are involved, since it's a quite big societal reaction for a minor crime. Last picture. So, when we see at Narkotikapolitiskt Center that, and I guess you do as well, that the media debate is talking about some questions like legalization or other issues, on the grassroots level, they talk about totally different things and different solutions. And in those municipalities that have come a far way, like Trollhättan and Norrtälje and several others, they see other solutions and they see really good results that we think should be spread. And some of the results they mention is that they see an increased knowledge and trust within society between these actors and authorities working around the child. They see a lower consumption, they see economic gain, they see an increased security when they do follow-up studies among the whole population in the municipality. But they also see that the support for children and young people comes in an earlier stage, which means that they have less extensive interventions are needed. And that means also a lower cost, of course, for society, but also less suffering for the individual and for the family. Yes, so that's the last picture, and this is the address to our website. And if you're interested to read my report or any other reports that we have at Narkotikapolitiskt Center, you will find them on our website. And we started a bit late, and I'm a bit late now. I think I've stuck to my time anyway. But do we have any questions, Peter?
Okay, thank you, Sara, for this picture you have given us. Are we having any questions? No questions, and I think we all want to have Swedish fika. Actually, it's coffee and tea outside here, and you will have a big thank you from us, and it's this UNICEF, of course. Yes. Thanks. But also some chocolate. So thank you very much for this.